Hello, I am Dr. Shilpita Banerjee, Gynaecologist and Maternal Fetal Medicine Specialist in Motherhood Hospital, Kolkata. Today we are going to discuss a few things about recurrent pregnancy loss. A woman or a family, when they enter with a history of recurrent pregnancy loss, which means consecutive 2 or 3 losses within a span of 20 weeks of pregnancy, we have to be very cautious in the words during counseling. We probably will have a pregnant lady, or we'll have a lady who is planning pregnancy. We are always happy when we get the woman in the pre-pregnancy period or interval period, because that is the time when we have some time to work out and find out a cause of this recurrent pregnancy loss. Sometimes, in 30% cases, we will not be able to find out any cause of the pregnancy loss, but still we have to find out a way to go or counsel that patient. So, our main target will be removing the fear, anxiety, frustration the lady and the family as a whole suffered, and give them a positive well-being and positive insight into what they are going to do in the future. We know that recurrent pregnancy loss has a lot of causes. The most common cause being chromosomal abnormalities in early period or uterine abnormalities in the middle stage of pregnancy. There are other common factors like hormonal disturbances, sudden medical complications arising in pregnancy like a fever or any hypertension, diabetes, hypothyroidism. Simple things are very easy to treat, but when a genetic factor comes or there is a medical cause, we will need a multi-speciality approach. Inclusion of the endocrinologist, inclusion of the nutritionist. Sometimes the patient is psychologically so weak that we have to include a psychological counseling for this particular patient. And all this requires a very good tertiary setup, which motherhood provides, as well as a team who is always positive in approaching the patient and the family. We know when there is a recurrent pregnancy loss, there is a lot of financial implication on the family. So, if we treat the patient very scientifically and do the investigation step by step, we will be able to help the family more than jumping and advising a lot of tests together when the patient becomes very confused. So, the first step of approach is always with a smile, counseling the patient who has come with so much depression, but with a positive attitude to fight again. I hope that whenever you come across a patient who has undergone recurrent pregnancy loss, you will always spread this message and let them come to us for help. There are some very simple tests which can be done and we can come to a cause. There are sometimes very complicated tests and that requires time, duration, and also a little bit of patience from the side of the patient as well as the doctor to treat a recurrent pregnancy loss. Hope you have a very healthy pregnancy in future. Thank you.